July 29th, we had noted that that was at least the planned ending of the weekly Berks County COVID-19 data report. Unfortunately, over the last several weeks, the COVID data for not just Berks County and Pennsylvania, but for the entire country has gone up significantly. And as a result, we are going to continue with the COVID-19 data report. And at this time, I want to recognize Brian Gottschall, the director of our Berks County Department of Emergency Services, and our lead for the Berks County COVID-19 leadership team. Brian Gottschall.
Thanks, Commissioner, and thanks for the lead in explaining to folks why I'm back here. Yeah, as you said, August 12th, I want to take a look at our cases and testing. Again, blue being our case count over the last 14 days smoothed out. Orange being our testing over the last 7 days smoothed out. We can see that both of those metrics are on a fairly steep upswing. I would just draw the attention of the public to kind of the steepness or the slope of the curve that we're seeing now in comparison to the similar slopes that we saw prior to previous surges of COVID in the community. Likewise, our test positivity is up dramatically, not surprising. We know that, of course, particularly as the concerns about the virus has waned, folks would not be going to get tested were they not either believed to have been exposed to somebody or feeling some symptoms. So it makes sense that as there is more COVID in the community, our testing is going up, and that those tests would be more likely to be positive because that's what presumably motivated the people to go get tested in the first place. Our hospitals, again, everything still continues to look good. There's no indication that they're being overwhelmed or being stressed, but we are seeing the case count at our local hospitals go up week over week at a slow pace, and would expect to continue to see that be the case, although continue to be hopeful that because of the fairly significant amount of vaccine that's been accepted in our community, that folks who are catching the COVID virus are not exhibiting symptoms to the level that they would need to be hospitalized or obviously ultimately die. Another bright spot in our data report is our COVID deaths. We continue to average just about one per week. As we said before, each one being an individual tragedy, but the good news for the community is that that number continues to be very flat. On the vaccination front, essentially no move across the board. We continue to be ninth by population, and our number per capita when controlled for population remains unchanged at 25th in the Commonwealth for fully and 21st in the Commonwealth with at least one dose. One mention I do want to make is that the per capita data can be a little bit misleading, and I've even seen this in some of the reporting that's been done by our local news outlets where they talk about per capita data, and it looks like there's broad disparities. Just to kind of draw this point home, if there was only one person per capita unit difference among counties, it would still create an ordering. So in other words, just because we're 25th doesn't mean we're miles away from 24th or 23rd or 18th. You know, the order is created based on the raw numbers. Simply looking at it in this context doesn't tell us how far apart those numbers are. And when you go through this list, you see that there are some examples where the numbers are broadly apart. There might be hundreds of people different per capita from one number of order to the other. But then in other cases, there's only 2 or 3 people per capita. So one could argue that we're really, if you would count those that are close together as being ties, we're kind of more around 17th or 18th per capita in the Commonwealth for fully vaccinated. I think we all want to do better, but in comparison to our quote unquote Pennsylvania neighbors, we're doing a pretty good job. When we look at that on the thermometers, we see that Pennsylvania has achieved about 63.8% of the population over 18. Berks County is at about 59% of the population over 18. On the really good news front, we've talked for a long time about our goal where we include those who have gotten their first dose under the hopes that they'll continue forward and complete their vaccinating series. And as of this week, we have actually passed that 70% goal. We're at 70.2% of those over the age of 18 having received at least the first dose of the vaccine series. we hope that folks would continue and complete that series, although the reality is that as you look at these numbers and look at the growth of new first doses versus completed second doses, I think the reality is that there's a lot of people who are in that first dose only category who, at least at this juncture, appear to be unlikely to move forward and complete the vaccination series. And again, as we've said all along, we respect that this is a personal decision for individuals and their families. All we would continue to keep encouraging folks is, please don't make the decision based on social media or the rumor that you heard at work. Talk to a medical professional, get advice, and then make your decision based on the best advice that you can get. Of course, to wrap it up, we want to remind people, if they are interested in finding vaccine, doyourpartberks.com. Our external affairs and public information officer, Steph Weaver, continues to do great work in trying to get information about vaccine clinics being offered in the community and collect it there. Also, you can look to your local pharmacies or your local healthcare professional, your physician, your clinic, wherever it is you go to get your healthcare, and they're great resources also to provide or at least steer you towards vaccine. That's what I have, Commissioner. If no other questions, I'm done.